I mean, it does look like a human heart shape.
Oh dear. Oh, that's not right.
I'm Associate Professor Theresa Larkin. I teach in the medical school, mostly anatomy, but also physiology.
Dr. Ian Murphy's my name. I'm a sports and exercise medicine physician, and I too work at the Graduate School of Medicine, where I am the academic lead for professionalism and leadership.
Ian and I are going to be looking at some videos with some medical content, anatomy content, and we're going to suss out whether we think that they're accurate or not.
Sounds like a lot of fun.
Ooh. Oh goodness. Oh. Okay.
Ooh.
I mean, it does look like a human heart shape.
Oh dear. Oh, that's not right. That is not
Why
right.
is that dog there, and why was that being carried in just a little esky?
It's not. Yeah. It's. Oh, there's a sinister element here too. There's more to the story than we know.
Can I just say that when we transport any kind of a sample in laboratories here, it's in so many layers. You can't just carry something in an esky.
No.
Even just to move between labs, we have to put it into multiple layers. So imagine that.
Yeah, I would venture to suggest it's unheard of that a human heart is being carried through reception in such an ad hoc manner. I have to say I was surprised at the amount of treatment taking place in reception there too. Patients on gurneys sitting in the reception of the hospital.
And dogs willy-nilly.
Dogs, well, of course we do have support dogs,
yep.
And obviously for those blind who need them. And so dogs have a place, but generally not on a lead like you're walking them through a forest. And so I would venture to suggest there is some deviation.
Are you suggesting it's not right?
I'm suggesting some deviation from reality.
Yeah. You've never run through a hospital with a human heart in an esky, Ian?
No. And I'm not sure how useful that heart is any longer after it's been through the dog. What did you make of that heart? Is that what we typically expect a human heart to look like?
When it first fell out, I thought, oh my gosh, it just looks like a model. It does look like a human heart, the shape and everything, but so I feel like they've done an okay job, but I feel like they've made it up a little bit extra.
I think there are some pretty significant professionalism issues around how transporting's taking place.
Yes.
It's not 6 beers in an esky, is it? It looks like it's just a esky with some ice and a heart. Generally speaking, these modalities are much more contained, and that heart would be wrapped in a very sterile container and plastic and so forth. So
even a bit of sticky tape would have helped there.
Anything might have helped that. So I think that's a fair way from reality.
Rheumatology Roan was almost right. It causes autoimmune symptoms.
Leprosy?
Yeah, that's real big in the Jersey suburbs.
It's leprosy.
Again, another great example from house. It's never a common cold. It's very much the rare things that you never actually ever do see in practice, but they make for good TV and drama. There is a saying that when you hear who's, think of horses, not zebras. And in this case, we see a lot of zebras rather than too many horses.
But it's obviously dormant in the dad. How could the kid catch it?
It's not dormant in the dad. It's just slow. Damaged his ulnar nerve. Was misdiagnosed as carpal tunnel.
So ulnar nerve, here, carpal tunnel, usually median nerve, Ian.
So not the same?
No, but he did say which was misdiagnosed as carpal tunnel. So I guess that's kind of okay, But that's a pretty poor misdiagnosis, isn't it? Because ulnar nerve very different to median nerve coming through that carpal tunnel. People who have carpal tunnel, it's right in that spot where the median nerve really is.
Yeah, and where's
but
the
ulnar's your funny bone.
Yeah.
Yeah, and then it runs down here.
Yeah. Totally.
But love that they're throwing in all the terminology.
No wonder he got anthrax. The leprosy
Anthrax
weakened
now.
his immune system.
Vicious circle. Leprosy made him vulnerable to the anthrax, and the anthrax treatment put the leprosy in overdrive.
But the antibiotics we gave him,
Thus it is proven. I rest my case. We have not heard a horse.
Yeah, that's
we have
what,
not heard a
zebras.
zebra. We have not even heard a zebra. We've had a unicorn walk into the room.
we gave him, they cure leprosy.
Yeah. That's that's where the trouble starts. The antibiotics hit the nerve strands, they kill the leprosy bacteria, and the corpses get tossed into the system. And as fascinating as our bodies are, they're also stupid. Produce antibodies to beat dead bacteria. And these aren't the polite antibodies. They're the ones that won't sit still, kick during nap times. They attack his neural and fat cells, causing inflammation and all the rest of his symptoms.
So the cure's killing him.
I want you to call down to Carville, Louisiana. Home.
Is that often just stated, Ian?
It's a great leap and it's a quick leap. But there is perhaps some truth to the basis of autoimmune disease. We do sometimes find that our own antibodies respond to a foreign invader, a bacterium, can then start to attack other structures in the body, whether they are other illnesses or they are or the body's own tissues. It's a case in point of how broad autoimmune disease is. So there is some basis there, but it is, I guess, reflective of good television that they are able to piece a story that would typically take days, weeks, maybe months to piece together. They've done it in, what, 2
minute
minutes?
and a half?
Two minutes between a set of ads. So full marks to House again.
Yep.
Yeah.
Cellulitis right there.
Actually, Dr. Cox, I was watching TV last night and they had this special on flesh-eating bacteria.
Necrotizing fasciitis, yes.
Yeah, I think they called it flesh-eating bacteria to sound more flashy.
I mean, a lot of accuracy in that and a fair portrayal of necrotizing fasciitis. And cellulitis is a common diagnosis to see in an emergency department. So full credit to Scrubs at this point.
Okay.
They're onto something.
More flashy, you know, hook in all the idiots.
Apparently it worked.
Anywho, point being, they said it was very easy to confuse cellulitis with chompers.
Chompers.
Chompers was the animated flesh-eating bacteria that narrated the special.
What is interesting here, Theresa, is the dynamic between the junior doctor and the senior doctor.
Yeah.
That is the reason I exist in my role, really, is to try and bring some better behaviour around professionalism and leadership, which a senior should be doing for a junior. Certainly bullying and harassment are two common words we use in this setting of professionalism and leadership and trying to make knowledgeable doctors better behaved doctors.
Yeah.
I have a sense that this isn't the first time, well, it isn't the first time and it won't be the last time where a junior doctor has actually had a good answer and a good suggestion of what may well be wrong here, but the senior has dismissed him and could well be about to be proven
Yes,
horribly wrong.
okay.
Come on, trust yourself. I think you're wrong.
Oh dear.
Really?
Oh dear. Oh dear.
Well, I think you're...
Brilliant! Necrotizing fasciitis. That's a 1 in a million diagnosis, son.
There you
1
go.
in a million.
1 in a million.
Nothing, sir. Anyone could have made that call.
And yet, they didn't. The student becomes the teacher, eh, Perry?
You'll note the senior doctor has the white coat on
Yes,
and
yes,
looks
true.
very senior. You'll go a long way these days to find a doctor wearing a white coat.
Yeah,
So that's a made for television rather than a reality. The reason being is that lab coats have cuffs and they have long bits and it all sort of floats around and there's a bacterial an infection prevention and control issue there. And you'll notice now the senior of the senior again has the white lab coat on.
Yes.
And has the gold stethoscope.
Yes, and then it's gold. That's so funny.
It's good telly and not bad medicine. Occasionally rare things do mimic the common and you need to be on the lookout for them. And you also need to be open to other people's perspectives as a senior doctor, because out of the mouths of babes comes some good stuff. Oh.
God, mate, you all right? Yeah. I didn't see you. I didn't see you at all. That's okay, yes, okay. I'm sorry now, I just didn't see you there. Yeah.
Okay. So it looks pretty minor at this stage, Theresa.
Unless what?
All right.
Patrick?
So he's losing consciousness
Yeah.
here, and we've got a minor bang on the head.
Thinking like a vascular event, that something might have hurt.
I'm thinking something more has gone on here.
Yeah. Because it didn't look like he hit his head too hard, but I suppose if he'd thrown his neck, could he have done a vertebral artery dissection or something like that?
Yeah, you might picture an athlete on a football field or something, having a collision and getting knocked out straight away, and they are immediately unconscious. And this is not the case here.
Because if it's sort of slower like that, is that more, are you thinking a pressure change or like blood volume?
Perhaps something like an active bleed. When the volume increases as more blood is being pushed in, the volume is increasing and the space is the same, the pressure's going to rise, and that can have a flow-on effect for the brain, which may well be playing out here.
And because you've only got like minutes, don't you, until, the brain's being deprived of oxygen.
Yeah.
A few minutes until you can get permanent damage.
As the pressure rises inside the skull, and it starts to press on the brain, obviously it can lead to brain dysfunction, and we notice the slurring of the words, and this is a really emergent situation. Absolutely. Can you hear me? So this is, really dramatic, and they're doing all the right things, checking the eyes to see if what's happening with the pupils, because again, with pressure.
Especially because obviously like all of those reflexes and the cranial nerves in the brainstem, and that could be affected by any herniation of the brain down.
Correct.
So they're really thinking that the brainstem as well as the brain,
something's going horrendously wrong.
He had a subdural bleed in the meningeal layer between the dural mater and the arachnoid.
Oh, God.
And it was very messy in there, and we worked to ease the pressure and to locate the source of the bleed and to suture the blood vessels.
How is he? Can we go and see him?
I think that's a fairly accurate. The anatomy you're comfortable with?
And the timing, because it's the bleed that's happening in that space that is slowly then compressing and slower blood loss. So it makes sense that at first he thought he was fine, and then gradually, but then suddenly, because I guess once you get a threshold of the effects on the conscious centres, that's it.
Yes.
You're unconscious.
It's an accurate depiction of where things are at.
We weren't successful.
What?
We did everything we could, but he didn't survive the procedure.
That is realistic. We often hear stories, don't we, of people who have had seemingly innocuous things occur, and they've had a catastrophic event happen and people pass away. So it's a sad situation, but actually a pretty realistic depiction of what can happen. Oh. What's happened?
Let me take a look. His jugular vein's been cut.
Does anyone have a clean cloth? Please, someone.
I have a fresh change of clothes in my bag.
That's great.
So jugular vein?
So you've got two. You've got an internal jugular vein that comes from your skull inside, and your external's a bit more to the edge.
Yep.
So it could be either of them, because the internal jugular vein is huge. It's a bit deeper, but it's still not that deep, and that cut looked pretty deep.
Yep.
But that's the blood, all of the blood coming from your brain, your face. But that looked like a deep cut.
And
yeah,
so
you know when they say go for the jugular?
fatal consequences pretty quickly?
Yep.
Oh. So pressure's a good thing. Yeah,
Yes.
you've got an open bleeding wound, a bit of pressure is a good thing. Yep.
You have it in the wrong place.
I think I remember enough of Anatomy 101 to know where the jugular vein is.
You would be in the right place if he were an adult. He's not an adult. He is a boy, which means you're also putting pressure on his trachea, which means he's not currently breathing.
So whether you're an adult or a child, there's the same relationship there with the trachea and the jugular vein. So yeah, the trachea is much deeper though.
Okay.
And so at that point and in that angle, I don't think he's really pressing, he's not obstructing the trachea.
So that's obviously where the air's going in and out of the lungs.
Yeah.
And that's pretty hard to compress, isn't it?
Yeah, because it's got all the cartilages.
Yeah.
Yeah, so it would be hard to compress, and especially on that angle from the side. So there's the trachea with the cartilages, and then the jugular vein is just external to that. But with the pressure that he would be putting on there to stop the jugular vein, I don't think he's going to also be, unless it was huge amount of pressure. But if he's a medical person, hopefully he knows what pressure.
So good terminology.
Yep.
But perhaps a little dramatic.
Yeah, weird to think that it's different because it's a child.
Okay.
We've all still got a trachea going down there.
Okay.
Yeah, so that was a bit weird. Yeah, we all have the jugulars.
Okay.
Yeah.
I think we should just pause and note there is a real infection issue here. You know, obviously this person's gone through some glass and that could get dirty and all the rest of it. But also now we're using all sorts of, I think the change of
Clean clothes.
Clean clothes.
Yeah, someone's...
Clean clothes is a relative thing.
Exactly.
And whilst clean to the eye, the sterility of clean clothes that have been sitting in a handbag or something is something far different to what you might experience in a health setting.
Let's see. Oh, let's see. So yeah, they looked okay. Median cubital, median antebrachial, yep.
You happy with those?
Yep. So those veins, so they were obviously doing a bit of a superimposition there. But yeah, no, I was happy with those veins.
Obviously they dramatised that and those veins popped out, but you sometimes see a lot of people with really prominent veins.
If he's losing blood, then there's going to be a reduction in his blood volume.
Yep.
So that's actually going to make those veins more compressed, so they'll be less noticeable.
They'll disappear.
Yeah, they'll disappear.
Okay.
So dehydration is the main thing to make those, you know, really less visible.
Okay.
And then heat's the main thing that makes them visible. So it's going to be really hard to see his veins. Oh, they've already patched it. Venous distension increased.
The veins in the boy's left arm are popping.
Is that bad?
I don't see.
Intrathoracic pressure.
No, his chest is rising. He's breathing.
So the veins in this case then could be popping if something was blocking the veins that are closer to the heart.
So you're backing up like traffic in a traffic jam.
But it wouldn't happen just from what they said from the intrathoracic pressure in general. There would have to be something specifically squashing the deeper veins that are coming from the arm back to the heart. So let's see.
Where they're going.
The chest is moving paradoxically. The left lung is in distress.
So something's going on intrathoracically. Right.
Yeah. So a pneumothorax they're referring to there. So obviously that's where air has gone into the lung cavity.
Yep. It's got in the wrong place. And so that's increasing as they are breathing, as the patient is breathing. There's air being drawn in, but it can't escape again, so the pressure is rising, and in theory, compressing the venous return.
It'd have to be a lot of pressure, though, wouldn't it?
You know, they're taking some license.
Yeah. Okay. Yeah.
I need a knife. There's a medical emergency. There's a medical emergency.
Now, surely there are medical people, though, in an airport.
The top looks very sharp.
First aid, there'd be some sort of a medical, you know, why isn't he getting someone who's got a bag, a doctor's bag?
We should also bear in mind that this is all time, and tension pneumothorax, as the diagnosis here, is a life-threatening condition. One of a very few number of life-threatening conditions that need treatment literally within a minute or two.
Oh, it's just...
Oh,
okay.
Okay.
Pouring it just everywhere.
Okay.
Indiscriminately.
Yeah. Creating a one-way valve here, so that allows air out, but not air to come back in.
Okay.
Yeah, and albeit in a slightly more medicalised device, that is done in a hospital setting. In a case like this, you would typically release the air, and there are other mechanisms you can do in a much briefer moment in time to get the pressure relieved. Here we go. Are we bubbling? Look at that.
Oh, so the air's coming back
The air
now.
will continue to leak and accumulate until the damage can be properly repaired. The tube allows the air to get out. The water in the bottle stops the air from coming back in.
So
Very
it's done.
clever.
Yeah. And there he is.
Breathing.
Wow.
So that's...
Okay. Wow.
Whilst heavily dramatised, that is a not unfair depiction of how you might address a tension pneumothorax.
Do you think it is possible that you could use literally that kind of tubing and any liquid if it's a tight enough seal?
I think that's taken a touch too far. The bit that really mattered was popping a hole from the outside weld to the inside weld. But that's that's a good news story. It's ended well.
Thank you for watching. The University of Wollongong has plenty of experts, so let us know what else you want to see people reacting to.